We're back at UTMC with Dr. Paul Rega, who is an expert in emergency medicine, and we're talking on a topic that is timely for this time of year, not necessarily a specific emergency medicine sort of topic, but winter depression, SAD. What does that stand for?
The Seasonal Affective Disorder. This is a depressive type of syndrome that occurs at a particular time of the year. Usually it will occur in the winter months. Usually it'll affect more women than men. Usually it'll occur in the more northern latitudes as opposed to near the equator. And people get this year in, year out, year in, year out. The diagnosis is usually made over the course of time by answering a questionnaire, going to your physician, ruling out other diseases, both psychological as well as medical, that could cause similar symptomatology.
Okay, so this is very real. This does happen to people. It's not just our imagination. If we think
no, yeah, exactly. I think probably at one time people said, "Oh, this, the person is basically nuts," and now there's enough literature and there's enough science behind it to say that indeed this does occur. And for the most part, these depressive symptoms can be, mild to moderate, and they can be usually treated with some mild medication or with light therapy, which has been shown to be effective. Sometimes these symptoms can be severe, also life-threatening, suicidal. So we have to be cognizant of that.
Let's talk some prevention rather than, someone who's already feeling depressed. If somebody knows that they have a tendency, a family tendency, that sort of thing, are there things that you can do during the winter months to try to keep your spirits up and keep yourself in the best of health?
Well, yes. Number one, I don't know if this is an inherited disorder. It might be. I don't know that. But if you've been told by a healthcare professional that it looks like you may be having something like SAD, there are ways of treating that. Working in there's light therapy. You can check with your physician or your healthcare provider as far as what kind of light boxes would work best for you, because there's a particular type of light that will help mitigate that particular problem. Exercise, going outdoors. Just simply going outdoors in the bright light has a way of helping that aspect up. I think the big thing is that the people who have this disorder have a certain number of symptomatology that the family should be cognizant of. People who are socially withdrawn, people who are having problems with sleep, people who have problems with anger, certain behavioral changes. Can be a tip-off that this may be seasonal. They see this happening every November, December. There's a drop in libido. There's a drop in activity. There's a drop in exchange of interactions with other people. All these things will occur. And there's also an interesting finding that people tend to eat more, with this particular problem.
So winter weight gain might be associated.
Yes. Carbohydrates, big time. Which is kind of like goes against the grain as far as what depressive people usually do. A lot of times they will not eat as much, or they will lose weight. Here there is a propensity towards gaining weight.
Trying to lift one's mood with carbs, maybe?
I don't know the science behind that.
So where should you go if you're having some symptoms?
If they suspect that, then they need to go to the healthcare provider. There are validated tests, questionnaires, and things of that sort that will tip off the healthcare provider that this may be seasonal affective disorder, which is a psychological problem, even though it's involving the neurochemicals of the brain. The other thing is that they will also do tests to make sure that no other disease is causing this particular problem, like thyroid or some other kind of disease that can be easily treated, not with the medications that you would normally treat for SAD.
Okay. Well, some helpful background. Thank you very much, Dr. Paul Rega. From UTMC, that is tonight's Talk Back.